Welcome back to the Cuba Data Science channel. I'm just kind of following up on a story. It's apparently Washington State has decided to implement some pretty severe lockdown procedures for the next 3 to 4, maybe 3 to 6 weeks. Uh, I'm just going to do a very quick Excel analysis. I'm also using a database now. A couple of points. You can use any database you want with this. You can use Excel. You can use what's DB2. You could use you can use the LibreOffice database program. You can use MySQL. I'm using SQLite, and I'm basically importing the data from the CDC. In this case, I'm going to be using New York Times data. Okay, so we'll take a look at the New York Times data uh, for Washington State. So if we come over here, uh, States Daily. Okay, and we're going to do a copy here. Open up Libre Calc. This is only Washington. We don't need this. Total deaths are cumulative numbers. Let's get rid of this. Let's come over and do this. So let's come over here. Let's format this. Dates. Let's come over here now. Let's sort by date. Right? There we go. So let's begin by plotting, as we always do, total cases. Cum cases. Do that. Now let's get over here. Let's take care of total deaths. Cum. Okay. Okay. So now let's come back over here. Copy this. Copy this, this, edit, copy, new sheet, paste this. Okay. Now let's do a plot of, let's do this. Let's put that up there first. Let's do a plot of new cases. Okay, so now you see here, these are daily cases. All right. So Washington State is not doing a very good job right now. Okay, it's just as simple as that. And all probably, honestly, a lockdown probably isn't going to change that much for those folks out there. I hate to say it, but okay, boy, there sure is a lot of volatility in Washington State. But it's interesting. The movement really is pretty much pretty horizontal. Interest, consider the fact how many cases they have. The deaths are, interesting enough, are very horizontal. So let's do one more thing here. Let's get rid of these. Then let's do ooh, yes. Let's do a 14-day moving average, the way I do it anyway. Well, first of all, let's try. Let's do this. Moving average, interval. Average, 14 days. So let's do cases. Well, that didn't work, did it? For some reason or other. Let's just moving average. For whatever reason, they're okay. So let's come down here. Let's do a 14-day moving average. For whatever reason, the average that calculates just doesn't look right. Okay, let's change this to numbers. Get rid of this. Okay. So we come over here, do this, and do this. This should give us a moving average. Okay. Now this is interesting. So this is interesting about Washington State. Okay. Okay. It does pretty much move horizontally, which is really kind of strange. Now, what has to come over here? Bring us down to here. Okay. Let's do this. So, well, that didn't make a lot of sense, did it? Okay. So let's do a calculation here of equals. Okay. Well, that's okay, except for the fact, oh my gosh, she never actually served in combat. Okay. So anyway, I'm getting a little distracted. This is deaths. This is a 14-day moving average. Okay. So now, so here we have cases, right? Out there. Okay. Now the thing is interesting. What I have, this actually is a lot like Ohio's cases situation. What's interesting is that the thing that's interesting is the deaths are basically moving horizontal in in Washington State. Now, remember, Washington State is where it started at back in April, right? That's where the first cases were deaths reported in a nursing home. Now, unfortunately, the governors delayed, 20, 30 days before they began shutting down, locking down their states. By that time, it was, of course, too late. It's obvious. Okay? Okay? But what's interesting about this is that there's a lot of daily volatility, apparently. Okay? A lot of daily volatility. But it's basically horizontal. Look at the moving average. Look at the range for the moving average here. Okay? But look at this over here. Let's try calculating the mortality rate, okay? Mortality rate for our purposes is deaths. Okay. Okay. So let's look at mortality rate now, shall we? Now, again, what you see here is very simple use of okay. Now look at this. Back in March and April, we had two big spikes in mortality rate. This is 10%. Okay. Look how low Washington State's mortality rate is. That's because, remember, mortality rates. This has remained relatively low, like 300, 2,700 cases one day. But the trouble is the deaths remains fairly flat. Okay. 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 So let's get rid of these here. Let's get rid of all these here. Okay. The reason I'm converting these to numbers is so that I could okay. Okay. Let's try date greater than or equal than. Let's try 3-1. Okay. So this brings us up to the beginning of the first spike in April. This again is cases. You know what let's do? Let's go to 5-1 and take a look at that. Okay, look at this. There, well, once again, we have this problem with this volatility. A lot of volatility, and okay. So, I would say on average, you know, 4% is pretty high, but it's also pretty consistent. All right. Should we try a moving average for, why not? Let's try a moving average. Anyway, you can see this is 8%. So because of the volatility in their numbers daily, which I just don't understand, I can fluctuate that much. Um, uh, on average, I would say, if it, these numbers are pretty well split between here and here. A couple spikes. Most of them, I'm not sure how you have a negative mortality rate of. So I would say on average their mortality rate's about 2%, which is very good. And it's also very steady. Okay, so let's go and save this. Not quite sure where to save it to. And once again, you saw I've used very simple methods in order to get the basic numbers we need, and we can draw conclusions based on the numbers we have here. If we come back over here, we got the cumulative totals. Cumulative totals really aren't that good. Uh, okay, okay. So once again, this is deaths. Moving average, moving pretty much horizontally. Cases is showing an increase up to 25, maybe 2,700 a day. But what's this here? The mortality rate is actually fairly low, also. So overall, I mean, your deaths are at ranging between 0 and 20 per day on average, I would say. Okay, you could certainly do some descriptive statistics if you want to. So let's just do some descriptive statistics here, shall we? H 170. H1. Well, that didn't work too well, did it? I'm not quite sure what I did here, but it wasn't what I was looking for. That's for sure. So let's try Let's try descriptive statistics one more time. Oh man, what happened here? What's this? Okay. So anyway, I'm going to call this quits on this analysis for Washington. Uh, I mean, you had a low number of cases here, but yet your your deaths are horizontal. You're averaging, say, 5 to 20 deaths per day on average, I would say, despite a huge, a pretty good spike up here. Alrighty. So anyway, thanks so much for your time. If you're from Washington, you know someone from Washington, go ahead and share this video with them. Maybe get some encouragement out of it. Also, want to encourage you as always, to do your own research. You just saw how simple it really is to do this research here on your own. You can download the data. I'll include a couple links to data in the description below. So anyway, thanks so much for your time, and we'll catch you on the next report.